I'm Huples' cat. What am I going to do now? Well, I dragged myself back inside in the warm. Very toasty it is too. Okay, I've had a sprain and I got a first aid kit. What am I going to use? Well, I'm not going to use my gloves because I don't need to. I have a closed injury and it's me. If you're careful when you look around for these, you can get them for not too much money and they're actually a great idea. It's foam with aluminium inside it. If you can, carry 2 of these. And that's how you splint various things. Splint without socks on. You don't want this part there. This will be quite hard to do on your own, as you'll see. You want it firm around both joints. This is just not cutting it for me here. Now, I haven't used one before, so I'm going to persevere. But with the injury here, I want it here and here. I practice with it, it works. Can't imagine doing this if I got a broken leg. That would really be funny. There you go. It's not completely immobile. I would put a dressing over this to make it more immobile and you could figure it out a bit better. We all know about rest, ice, compression, elevation. But rest and elevation are the 2 most important parts of that. But let's try some compression. Should be no surprise to regular viewers of my channel. You should carry this every time you go for a walk. This is a cling bandage. This is one I prepared earlier. This is no use whatsoever for compression. These can be washed and reused. You have metal grips on them. Try not to lose them. Try not to stick them in your finger. So I have more space on this and it's more flexible so I can actually immobilize the joint probably better than using that splint. This is a wide one. I would use a narrow one for my foot, but I have what I have. I go around once, pulling, but not too tight, and then I go around twice. And then you do a figure of 8. See, I lost the compression there. And you can do this as often as you want. What I would do if I had this as an ankle injury is I would finish up this way. Now you can use tape on these, and if you do, don't wrap the tape completely around the limb. It's a good way of losing blood flow and losing the limb. There we go. This is much more compressed. So in the wild, what I would do is this, then to try and make it a little bit more stable. Good luck getting your shoe on after this. When you have the casualty like this, keep the uncut sock and you can put the uncut sock over the 2 toes, like so, for when you transport them out. If you're having to go to a splint like this, they probably shouldn't be walking on it. This is good because you can do your range of motion and your colour, your sensation and your mobility frequently. I wouldn't take this down every hour, but every 4 to 6 to 8 hours, depending on the significance of the injury, I would completely take all of this off, do a full assessment, colour, sensation, movement, capillary refill. This is a little bit more expensive and I don't know how useful it is for reuse, so I'm not going to try it. But this will stick to itself and you can make a much firmer grip with this. When done, wash this off, fold it up again the next time. This could be laundered and reused. Once it's dry, find the clips, don't lose them, and reattach. This could go in a Ziploc bag. In fact, I would suggest it does now, purely and simply because packs can get wet. You don't want rotting, stinking first aid gear. At least I don't. I also have an emergency sodas bag. Now there's also these that I got from the pharmacy for about $30 Canadian. This is in fact an ankle support, designed for chronic problems. There's a soft piece at the top and 3 holes in it. This really confused me for a little while. Foot goes in the big hole and out the top one. This one here is actually meant to be open. Once this is in place, you can put it on pretty firmly. Then you have this one to tie it all up all nicely. It really resists me flexing my foot. could be useful. You're probably not going to carry this on a hike. Now they also have a wrist one. I take large and Kitty takes medium, so I bought a selection. There's still a few missing, but I'm going to get a few more of these. Chronic sprain and chronic joint injuries is going to be a big feature of any major ongoing disaster. This also has a little piece in here, and it has a little piece there for the thumb. So you want the flat piece down here, the thumb there, and then when you do this up, you can make this as tight as you like. Bearing in mind that once you put it on, you want to check it frequently to make sure that the colour, temperature, sensation and capillary refill is normal. But it's a useful piece of kit. This could keep you functional when you've got an injury. It provides rest in the joint that's affected. This one's for the knee, and I actually want to get a decent knee support of similar make to that, but I haven't been able to find it in my size yet. I use this frequently because I have a chronic left knee injury. There's a circular pad, that's where the knee cap's going to go. What do you do if you've got an arm or an elbow injury? Well, you do pretty much the same thing. You still do the checks of the colour, sensation and movement. If it's an elbow injury, one of the things you'll notice, they're going to be like this. With ankle, toe, elbow, arm, the casualty will tend to put the limb in the position that's most neutral for them, the least pain. And you should use that as the guide for how you fix it. So in my case, I don't have anything. How am I going to rest my elbow? It's not very efficient, but it works. There's other things you can do. If you have a triangular bandage, and I would recommend you have 2 of these in every kit, and actually have more safety pins than you get with these. In this case, I have safety pins with no triangular bandage. I am right-handed. Okay, so this is supported here, and I want more support on that. So what I'm actually going to do is this. Pull this right up and secure. It's a lot easier if you're doing this for somebody. There, so I have an okay support for this. It's not perfect by any means. Now hopefully you've opened one of these up before and practiced with it, because you should practice with all your first aid kit. It's a good idea. But this is called a triangular bandage. It's made out of gauze and it's actually could be used for various things. But it's called a triangular bandage because it's a triangle. There's various ways and means of doing this. The easiest way of doing this is opening it up with the top part that's the longest, getting both ends, and you're going to go left over right, right over left, or the opposite, because that creates a knot, and that knot is called a reef knot, and a reef knot is flat. You then put this on here like this, and what you basically do is get this in the position you want, tie it on, or use a safety pin, and then with this one down here, there's a corner piece, and you tie it on or use a safety pin. In fact, you probably have to use a safety pin, and then you have it. Now I would spend more time doing this and getting it done a lot better than I'm doing it today, but this is for demonstrations. Like I say, practice, see how it goes. So it's reasonable. This should be tighter up here, and you can adjust this yourself, and it's pretty good. But like I say, you want to put one of these around it. It does not have to be an ace or a tensor bandage, but it has to be somewhat secure so it actually holds it in place. Again, this is a lot easier if there's 2 people doing it. Then you secure it so it's actually holding it in position. So if I have a wrist injury, I want to immobilize these joints and this joint. Compression bandages are very useful for this. Try not to go this way. It's going to cause nerve damage. You don't really want to be using the thumb anyway. And then you do this. So you're going about 1/3 to 1/2 of the length and you're wrapping it up. And in this case, I'm also going to use the triangular bandage. The idea of this is to limit the movement in the normal joint that has no problem. So it doesn't transmit movement to this joint which has a problem. So this is not going to stop this from moving, but it just reminds me not to move it, and this is going to stop my fingers from moving as a reminder not to cause strain on here. And then I would put a triangular bandage on. Once you've got your compression bandage on and or your SAM Splint, if it's convenient, get whatever's available and then use another compression bandage to put that over the top of this to really reinforce the concept that you're not going to move your elbow. This is what plaster of Paris does. You can't move it. Again, check the colour, sensation and movement every hour at least for a while, and then do it about every 2 to 4 to 8 hours. Take all of this stuff off at least once or twice a day and have a good look at what's going on underneath it. Don't just cover it up and think it's going to be fine in a week's time. And now my kit's been put back together. I think I'm going to need a bigger case. Thanks for watching. I'm Huples Cat. Subscribe me if you like. You don't have to. Get out there, enjoy yourself, do it safely. Doodles! This has been a Tiny Terrier 2023 production. No terrier got cold during the making of this video.